My name is Ramin Tolouian. I'm a nephrologist by training. Um, you guys hear me? Or okay. Um, Today I'm gonna start the nephrology course. When you guys study every single organ, um, probably the nephrology might be a little bit the most complicated or something that even when you guys graduate, always says, I'm very good at this or that, but nephrology was tough. Uh, Acid base, electrolyte, a lot of calculation, understanding, math is always between all the other things that nephrology notoriously they call it, oh, this was tough, the physiology. So I'm gonna make it a little bit more fun and then to understand better. And then in reality, the nephrology is easiest one. I'm not trying to offense, but the design for dumb people. So it's so easy. But just I'm gonna show you guys the trick. Then hopefully after that you're gonna say, okay, it wasn't as bad as I was thinking. And I'm sure. And when I just talked to the team, they said you guys already the night before or the week before study about. Um, and I don't know that the people that they thought is easy or they thought is tough one. So who thought that is tough? So nobody read it. Huh? Okay. So today I do a little bit of the like a presentation on the PowerPoint, but I do some parts as a um, on the overhead. But tomorrow there is no PowerPoint. So for tomorrow, everybody should come closer. I'm not gonna yell. And then you have to bring the old-fashioned pen or pencil and piece of paper because we have to do a lot of practice with hand. Then it just stay with you guys for rest of your professional life that how to interpret acid base and ABG. This is the one that tomorrow I'm gonna practice with you. You may think that no makes sense for now as a first year student, but keep that one and take it with yourself for rest of your career. Doesn't matter which specialty you go, you'll use it. So tomorrow, please come closer and with a piece of pen or pen paper. Um, so should we start? Everybody's here? Yeah. Okay. So then as I mentioned, I'm a nephrologist, and Dr. Ahmadi once, when he talked about making this a school, asked me to make a team for nephrology team to at least present some clinical aspect of the whatever you guys do it as a basic. Um, so we have three more members of the nephrology team. That next week you're gonna see Dr. Kazuri. He's one of the very well-known nephrologists. He's a chief of nephrology division at University of Florida. He's very one of the expert in the volume um, and the intensive care nephrology. That next week you're gonna meet him, and the following week, Dr. Danish, he's a chief of nephrology at MD Anderson, and then he third week of your course is gonna be with him, and then we have another person, but it's not gonna be with you guys. So uh, we just picked a very well known and then very expert in this field, and hope you guys take advantage of their presence. So I'm going to start this uh, talk about the urine. Nephrology mostly comes with the urine. Uh, the one things that I want to tell you guys, the urine and the urine analysis is one of the things that we don't usually see in a common practice, at least in US, is one of the forgotten labs. So every time that you go to your doctor, they do the blood and CBC is like a routine, but most of the time they missed UA, and then has a lot of information, and sometimes even when they read the interpretation of UA may not be correct. So many of the some disease like in Japan, the UA is a mandatory for every screening, and they found like more IgA nephropathy versus in US. So it's something that I'm going to talk about. The UA is important, and then tell you guys about the US. So they, how many of you guys think that's the urine or that's the drink? Yeah, it's drink, but it could be urine. Okay, so let me just go with the. So today I'm gonna just talk about a couple of things, and then end of this one you have to diagnose hematuria, pyuria, calculate, and then appreciate more. Okay, so I'm gonna ask. I think Elisa just helped me. We're gonna do some um, practice. Is there some start with some question? Don't worry. This is mm, okay. So this one we're gonna do a couple of question, and then we ask the same question end of my talk, and to see how much you guys awake, and that's for me, not for you guys. Um, so let me just yeah, yeah, yeah. And one thing that I want to tell you that osmolality means the amount of the like when you have a water, imagine the kidney is a factory to make urine. So this factory has two components. Two, one is like a some type of collaboration between two different factory that work together. Like we make a contract. She's another factory. And I said, I put some water, and she said, I put some garbage and mix together, and we call it urine, right? So we have to have some uh, contract. I said, for every unit of the garbage that you put, I put 1 unit of water. So then it's going to be the urine with the some garbage on it. So the unit of that garbage in the in the water, we call it osmolality. So the amount of the garbage in that one, call it osmolality. So the question is in that one, how much garbage you have in the urine. So like in the trash can, so you want to set how much garbage is in the trash can. So you have to use some unit. We call it osmolality. So if you have high osmolality, means you have too much garbage versus amount of the water. Like sometimes the contract between us was 1 to 1. Sometimes he put 1 unit of garbage and I put 2 units of water if I drink more water. Sometimes he put 1 unit of garbage and I put half a amount of that, I suppose. So the time that you may be fast, you don't drink, so the amount of the garbage is more, right? What should I do? Okay, so guys, please with your phone, scan that. So you get 1,000 points for each answer. Okay, so see, You guys, oh, you guys able to get in? Okay, so let's move on. The next one, so that was the question. Yeah. So go to the next. So please vote. You don't see the result. Right? Oh, after all question. Oh, oh, oh. think- Come on, guys, do it. If you have 17, okay. 19, 20. You can. Okay. Good. That's good. So seems majority they said 600. Okay. And some people said send to the lab. Awesome. You guys are very good. The next one, what was that? Oh, okay. So the next question is, does pyuria means infection? Pyuria means the presence of the WBC in the urine. By definition, when you have more than 10 WBC in the urine, they call it pyuria. So when they do the urine analysis, you send the urine in the some container, and then they take one drop under the microscope, and they look at the some stuff that is in the urine. One of the things that they look is a presence of the WBC, is a white count, and if it's more than 10, they call pyuria. So I know that it's, but just go with the guessing. What's you guys thinking here? Yes, no. So you don't need to pick the third one because I told you guys what is pyuria. Okay. So so majority they said it's yes. Okay. So the next one, um, what is the taste of normal urine? So you guys learned today something that is not in the textbook. Okay, so I'm gonna. Oh God, this question, everybody excited for this. Everybody answered. Yeah. So the majority they said salty. Okay, nobody thinks it's honey mustard. Okay, so what is the odor of normal fresh urine? So don't use the last one. You know that. Okay, so I'm gonna stop. So majority they said odorless. So then which urine crystal is not normal? One of the other things that they look at under the microscope, they look for the WBC, they look for the RBC, means hematuria, by definition is more than three considered hematuria. They look at some like a cast that I talk later and some crystal for the people that they have like kidney stone. It depends. Sometimes they see some like a uric acid. They said, okay, probably you have or something. They said which one is not normal. So like it is a couple of those name. I mean for the crystal. Okay. So majority cysteine. That's good. So seems uh, okay. That's it. Thank you. So let's go back to. So we have to switch them. Okay, that's it. Okay, thank you. Okay, so I'm gonna just a little bit go to this real didactic part that in the Hippocrates mentioned all days that no other organ system or organ of the human body provides so much information by its excretion as does the urinary system. And this is very um, self-explanatory. But I want to just tell you guys about the it's not just really recently from the old days that the people look at the urine and then they come up with the diagnosis. And probably you heard the story that in the old days, they some of the way that they diagnose like a diabetes, they taste the urine and then they said, okay, this is sweet, and then probably um, people have diabetes. So, but mostly in the history they use this one, and the many part of the um, I would say world in the like in Asia, there is a popular use of urine they call urine therapy that I'm gonna just a little bit tell you guys about this urine therapy. What is that? In fact, some group um, they drink their own urine and then they believe that there is a chance that your body expose again to the antigen that they didn't produce antibody or something for the treatment of some um, chronic disease. Um, but it's some of the things. So in the people that they lived in the like New England area for the jellyfish, one of the things that you guys know they pee on the that part in the battlefield, the Aztec, they use urine on a open wound. And then another things that in the, um, believe it or not, in the old days, they used the urine for the tanning of the leather. Um, and then even for the whitening of the teeth, they used this. It sounds a little bit disgusting, but even there was different part of the Europe has a different part. Is like a apparently for the whitening of the teeth, the urine from the Spain was higher expense than it was a trade. They would sell and buy urine, and the Spain urine from Spain was higher priced than other parts of Europe. And then based on that tradition, even the I would say Nero in the Roman Empire started putting tax on the urine. That whoever sell the urine, they put the tax and they should pay. So in came, I think some in the Latin sense pecunia non olet, means money doesn't smell. It came from those days that they sell their urine. So, but what we should know about the urine, eventually, I mean, this is everything that we do. I mentioned to you guys about the jellyfish sting treatment. Was this in some part of the world, believe it or not, there is a can soda of the urine car, and I mean, I show you guys that the people use urine. A little bit fancier things was uh, the battery operated with the urine, um, and then they consider urine as a source of hydrogen, source of energy. And then in the University of I- Ohio, they started making the car that works with the urine as a fuel. I This was a video, but I couldn't download. Believe me, it's moving. And then they started some type of car, and it's gonna be probably in future. You can use instead of the solar or battery or something. But definitely they used as a source of energy and power to make that from the hydrogen. And now, as a joke, um, you can like a part of like a global warming. Um, it says always gets a lot warmer when I pee. Um, so that's the um, funny part. So now about the urine. So I'm gonna just ask that how much urine is considered normal, how much we should pee. Um, the average people they drink 1 liter and means quarter gallon, and then we pee 1 liter. So that's why end of the day we're gonna be the same weight that I was today. Tomorrow is gonna be I drink one and then I pee 1 liter. These days, because of the whatever reason, the people drink more. You know, that's like a half a gallon bottle. Um, not tomorrow, but I think one of these days, um, we're gonna talk about the how much water we should drink per day. What's the normal um, number? Like she has one, he doesn't have any fluid, has a half a that was more. So which one is right? Is he do the right thing, or I mean that's another um, day we talk about the water handling by the kidney and the body. So that's average, about 1 liter we drink. And timing of the urine, most of the time we pee in the daytime. When you go to bed and sleep, you shouldn't pee. If you find anybody in your family member that get up at night and pee, that's abnormal. That's a red flag. If you guys, any of you guys get up at night and pee, that's not normal. But people thinks that "Ah, I get up once or twice. Okay. If you get up at night and pee, maybe you have prostate issue. Then that's the reason you get up. So it's not normal. Just but when the people started getting up at night and pee, the first night they said, I think that watermelon that I had is because of that. The second night they said, I think I drink too much tea. The third night they said, that one. And after fortnight, they think this is the routine. I have to get up at night and pee. So that's not normal. So if I have an enlarged prostate, it's not going to happen in a 1 day to me. It's over 50 years. So when I was like 20, never get up at night to pee. But when they started getting bigger and bigger, maybe get up one time, second time, as I mentioned, you blame it in something else. And then I think it's a routine. Everybody get up at night to pee. Like I had some patient that one of them that it was funny and said, I get up at pee. I said, you never thought that it's not normal that you get up at night to pee? He said, no, in our house, everybody get up. Sometimes we have to wait to some come out and for the next person. So that's not normal. Means they have some issue that, I mean, you guys learn what is that. But my point is, If you have anybody said, I get up at night and pee, is not normal. Okay. So then um, about the urine color, um, everybody knows that the urine color is little bit should be yellowish, pale yellow, but it depends on the how much uh, water or fluid you intake. If you drink more, it's going to be diluted like water, and if you drink less, it's going to be more dark yellow. But it could be black, it could be red. I mean, the red means blood mostly, or sometimes you use maybe red beet or something change. It depends what you eat, or some food color may cause changing in the urine color. But you may see different colors. You may see green, blue, creamy. Um, the drink that I show you guys at the beginning, um, that could be any color of the urine that you imagine. It could be in that one. And then, so that's you can get some information from the even urine color, or even like a Coke. It's some disease that one day, we're going to talk about that um, in this week. So about the urine odor, mostly has no odor. I'm talking about the fresh urine that you just right away give. But it could be any of the other things. It depends to the some disease, but mostly in a normal setting, it shouldn't be any color. It's considered no odor. And the urine taste. So the taste is salty. That's a normal. And the morning urine, because it's more concentrated, is a little bit bitter, but most of the day, um, as I mentioned, but you may say, I mean, what is this? Why I should need it? Why I should know the taste of that one? First, because I'm nephrologist, if they may, I may get asked million weird question that I should know that what's the taste. And then sometimes I mean, nobody do, but I've seen patients that they use the urine therapy. They drink their own urine, and you'll see them. Um, like the famous, like Madonna is one of the celebrity that use urine. Um, but they think it's a, and there is a technique to drink. It's not like a shot is not. So, um, because mentally it's so disgusting. If I offer you guys, hey, let's drink our urine, he said, how should I do? I'm not going to do that, you know. Um, but in my career, I just gave one patient um, urine. So the mostly, as I mentioned to you guys, urine therapy is real. Um, when I was preparing, I mean, this talk many years ago, but when I read about this one and I did more, I said, oh God, it's a huge amount of the people that they use this technique of urine therapy. But mostly, as I mentioned here, everybody has done it in the mother's womb, because when you're there, you pee and you just eat it. You pee, and that's a system that is not something that, and you never done it. So, what's happened to the story of this urine therapy in, I believe, around um, in a 70 somethings, the Prime Minister of India, Morarji Desai, came to US to visit President Carter. And then at that times, he was 90 plus years, very sharp. And then they asked reporter that what's the secret? How you're more than 90 years old and you're so functional, so smart. And in his response was that because of urine therapy, I drink my own urine. So after that, I think based on the one that I found, it's become more prevalent and more is that the people use their own urine to become sharp and but it's something that's more common in that part of the world. But that was the trigger one. So this one, okay. So we're gonna watch this one together, and you guys probably know Juan Manuel Marquez. Need your help, I believe. Okay, it's a 1 minute. It's not.
When the training session ends, the gym empties quickly. And if Juan Manuel Marquez has shown himself to be a fighter who will go to any length to gain an edge, the conclusion of this day shows just how far. He drinks his own urine.
Yo creo que me ha servido, lo he hecho durante mis 5 o 6 peleas y me ha dado buenos resultados. También me tomo la orina porque de ahí también desechas proteínas, de ahí se desechan las vitaminas, parte de tu vitamina que tomas. ¿Y por qué en vez de desecharla, no te la vuelves a tomar?
Yeah, don't listen about that as a protein or something. But my point is just I'm not trying to convince you guys to start drinking your own urine, but people use. Okay. Uh, so that's the question that like, is it scientific or no? I mean, nobody use it these days, but the idea was because the body they wanted to expose. I'm not saying this is something that um, but just remember that some people they use, don't laugh at them. So, okay. So in the urine analysis, when you send the urine, they do, as I mentioned, something that they just look at this and they put a dipstick on it, and then based on the finding, they just uh, give you some report about the like every one they said like a clear or turbid or something or cloudy, that description of that in the any urine analysis. And then they started about the specific gravity. A specific gravity means they measured like the weight of the how much garbage in the water is there. Like if it's the water, it should be one. It's anything that is added is going to be 1 point, like a 0, 1, 2, 1, 2, something, whatever that number comes is going to be a specific gravity. And um, they check the rest of this is based on that deep stick. It's going to say, okay, is a pH like a comes with some number, protein they call 1 plus, 2 plus, glucose the same. And then they go under the microscope, put the one drop on the slide, and they look at this one. As I mentioned, they look for the RBC, WBC, cast, and crystal. So the one things that I wanted to tell you guys in the when you go and see the patient on the floor or something, usually urine osmolality is not part of the routine things. You have to ask really what's the urine osmolality as a new test. But if you want to roughly guesstimate what's the urine osmolality, a specific gravity is always in the um, report of the urine analysis. Take the last 2 digits of that one and multiply by 30. It give you the um, like a estimate of the urine osmolality. So, like in that case, that the specific gravity was like a 1.020, um, means based on that example that I gave you, it means if I always put 1 unit of water, and it depends how much garbage she added, that's this digit comes. If she put more, it's gonna be 0.30. If she put less, it's gonna be 0.03, for example. It depends how much. So it depends that number, the last 2 digits that she put as a um, I call it garbage, I shouldn't call it, but that amount of osm is considered urine osmolality, right? So in that case, like a 20 times 30 is going to be 600. Um, and after a while, when you do it in a practice, um, like I never use this, I asked like a resident fellow that said, okay, do we have urine osmolality? But in reality, when I look at the urine of the patients, they have mostly in the ICU or something, they have Foley, and you see it, the urine color. I can guess the uh, osmolality based on the one because I can see, I mean, I know what's the normal, like my urine color. And I said, okay, mostly I have that one is going to be 600 normal. If I say this more darker, means more concentrated, I said probably is more than 600. If it's become so diluted like a water, I said, okay, it's probably is very low, like a 300. So, but if you guys go to the floor, if you go to the clinic, one of the questions that mostly they ask, what's the urine osmolality? Have you checked that one or no? And then the other things is the urine pH. Um, urine pH, the normal urine pH is a 5 to 6, but it's a first of all, I have to tell you something. It's a very tricky. Um, it's not very reliable things that if you do it in the setting of odds patient, because if you guys go to the lab and they give you one container and said, okay, pee here, put your name, and then leave it and go. So you just go to the restroom, you put this one and you put here and leave. And God knows when the next person come collect this stuff. And then from here, I'm collect this one and I put this to the lab. And then if it's a time for the lunch or break or something, God knows when she's gonna do the lab. So the pH and the urine, when you pee, the urine that we discuss about has like a bicarbonate, hydrogen. So these two hydrogen that make acid and the bicarbonate bind to each other is become H2CO3, then dissociated to the water and CO2. And the CO2 just come out. So basically, after if it's not, you don't do it right away, so it's not going to be the normal or the accurate pH. So the best time that if you really want to do something for the urine pH, you have to put in the um, container, add some oil to just block exchange between the air and this one and send it to they do with a different type. But if they do it freshly, um, you can rely on this stick. But if you send it out, don't rely 100% on that. So another things that is a urine protein is very important. Again, you shouldn't have protein in the urine. Um, you'd like the protein like you guys eat and you take protein. You want to use protein to build muscle to get stronger. You don't want to lose it for no reason. So body doesn't want to lose protein. So even the design of the body is just protein has a negative charge, and the kidney overall, like in the sialic acid that covered the kidney and glomeruli, has a negative charge. By default, negative and negative, they should repel each other. So you shouldn't see any protein in the urine. So if you find protein in the urine, again, the same as you get up at night to pee is abnormal. Just if you lose more, is the outcome is worse. So um, the two methodology we do for the measuring of protein. One is the spot, and one you check 24 hours. The measurement of the collection of 24 hours, I'm going to tell you guys as a one thing, just remember, you guys see when you started like an internship or they ask you order or 24 hours urine. You put the order 24 hours and the nurse or whoever run this one, he said, okay, give the jar. Now it's 3 p.m. Tomorrow 3 p.m. I collect it. It's going to be 24 hours. If you order 6 p.m. or bring this at 6 p.m. and I collect it too. But that's not the right way. The real collection is should be if I want to give you some things, I would say, just do it over the weekend. I mean, just as an outpatient, normal things. He said Sunday morning, when you wake up, the first urine, just dump it because it's considered from last night. And then after Sunday, every time that you pee, you collect it in this jar until Monday morning. Monday, the first urine, add it because yesterday you dump it, and that's going to be 24 hours. So that's the way that you have to collect. Like if you do it like a 3 p.m. to 3 p.m., you don't know how much urine before it was in your bladder. You may over collect or you're under collect. So I'm gonna tell how we figure out that they sometimes they pee like I mean probably she's drinking that much water, she pee more. So I ask her that just give me collection. She would say, okay, she pee and collect, and sometimes because this is something new, right? And then I ask, put it in the fridge for me. So she put it in this, and she go to the bathroom and she pee, and said, "Oh shoot, I forgot to." But she said, "Oh, I pee a lot." She doesn't, or he doesn't understand. They they can't, but we can catch it. I tell you guys how. So another one is the urine glucose. Again, this is something that is a no-no. You don't have because it's like you work, you make money, you don't want to lose it. Having protein in the urine, having glucose is not uh, normal and is abnormal. Um, and then there is a sometimes we call some disease that you have a normal glucose, but you have glucose in the urine. So means something tubular problem they call Fanconi disease and urine bilirubin, the same thing uh, that test um, pick up for you, but doesn't mean that you have a liver disease. And the urine ketone, this is the one that the people that they have when they go for fasting or diabetic ketoacidosis, so it may pops up in the urine. Um, then, yeah, another things is a nitrate and leukocyte esterase. These are the one that bacteria uh, reducing nitrates in the urine. So most of the time, whenever they see um, leukocyte esterate positive or nitrate positive, and they see some WBC, all the PCP in United States at least, they said, okay, you have a urine infection. But remember that for diagnosis of the UTI, you need urine culture. So, but just presence of the um, white BC or pyuria doesn't mean that you have infection, but everybody, they said, oh, you have some UTI, but it's not. Just remember. So there are other things that I want to tell you about the blood um, that sometimes you see that color is changed and the people may say, oh, I think I have blood, but sometimes it's a pigment, sometimes it's a blood, but most of the time If it's a gross hematuria, they come and tell you. Sometimes it's a microscopic and they don't know, and they have different differential diagnosis. So that's the one that I mentioned to you guys about the hematuria. When you see the blood in the urine, the blood, you have to differentiate this where this blood come from. One category you have to distinguish or differentiate that this one came from the um, let me make it this way. You have to know that as a primary doctor, should I send it to nephrologist or should I send it to urologist? So you have to distinguish that this is came from the kidney stone, bladder cancer that I should send to urologist, or came through the like IgA nephropathy, Alport syndrome that I send it to nephrologist. So for distinguish these two, you go for the check for the looking for the dysmorphic RBC. Dysmorphic RBC means the RBC by default is like a round shape, like a ball. What dysmorphic is become means is that RBC went through the nephron tubule, and then you know that it goes to the like a low pressure, high pressure. I mean tonicity of the kidney, and then again. So during this passage, it gets puffy, shrink, puffy because goes to this environment and eventually it's become dysmorphic, it's become like a donut shape, it's become like a Mickey Mouse, some budding. So when you see more, you said, oh, this is nephronal, I should send it to nephrology. Not the one that is comes through the bladder or kidney stone, the RBC is just like a regular RBC and you see it is not dysmorphic. And I mentioned about pioneeria and the crystal, abnormal crystal mostly is a cystine. If you see that one is diagnostic, so you don't need to do anti-rosin, some stuff that has a different shape, and you can. Um, this is the one cystine. If you see this one in the urine is abnormal, and you have a diagnosis. So these are the one that I mentioned, and cast it's something that um, it depends to the volume status. You may see some, like if you have a hematuria and too much RBC, those RBC may become like a cast, is like a block of the uh, RBC, block of WBC. It depends. You come up with the name. So I think I have 5, 6 minutes to. Um, this is for the things that now they those questions. I mean, I don't think have time to with this one. Now, what's the urine osmolality? Take the last two digit, 20 times 30, 600. Good. Um, then does pyuria means infection? No. So presence of the, it's like a, um, in this room, the door is open and most likely whoever here is should be medical student. Like if I said, does it mean that everybody in this room is medical student? You will say, most likely. But if something happened to this school, like a post, whatever, tornado, God forbidden, hurricane or something, that there's no door, no security, nobody, then anybody can come in. So that doesn't mean when they have a most likely WBC shouldn't be. It probably has infection that's come. But if you have some interstitial kidney disease, means there is no door, nothing. Anyway, all the time, nobody can stop them. They come in. So it doesn't mean that. Uh, so what's the taste of urine now? You guys know it's salty, and the odor, you know that's, um, and the crystal is not normal. The one that's cystine. Um, I'm gonna just tell you guys a couple of things that you may hear about in the um, on the floor. So I have to change to this. So the first of all, the definition of oliguria. As I mentioned to you guys that the normal urine is about a liter. So whenever you have less than 300 cc urine, they call oliguria. And when they call less than 100 cc of urine, you call it anuria. So I want to tell you guys what's the rationale for this one. Why, who come up with 300? Why not 299? Why not 500? So for this one, you guys see, yeah. Um, if this is the 600 milliosm that I mentioned to you guys for the daily amount of the normal things that we make this contract, 1 liter and the urine and the 600 so it's going to be the unit of this one 600 milliosm per liter, right? That's the this one. So now if I just drink um, this is 1 liter of urine. So now I drink more and I make 2 liter of urine. So how much gonna be the osmolality of this, right? Become more diluted. So now I'm fast and I don't put any um, like half a liter of urine. So it's gonna be 1200, right? So the maximum dilution capacity of the kidney is gonna be like 100, and the maximum concentration that the kidney can do is 1400. This is the maximum dilution and maximum concentration. So for having the 1400 is 100 is going to be 300 cc of the urine. So means if I have a trash can here and then we maximum amount of that we can concentrate, this one is going to be 1400 milliosem. Means if I just like in that contract, I said put I put this amount of the fluid and said I put this much garbage. After 1400 unit garbage that he gave me, I said I can't take it anymore. So when it's done, and he said, oh, I have more garbage. So then I said, keep it next week or something. So with the maximum capacity that the kidney able to dump all the garbage, at least you need 300 cc urine. If your urine become 299, means some of the garbage stay in your body for the next week, for the next time. So it's become uremic state. So that's the why 300 is very important. That said, okay, how much urine you make? He said nothing, or 100 cc, or 200. You know that this some of those uremic toxin stay retained in the body. So in the other way, if you drink more, if you drink 4 liter of the fluid, so it's gonna be 150. If you drink 6 liter, it's gonna be 100. So it's the maximum dilution. If you drink more than 6 liter, what's gonna happen? Means the kidney not able to dump all those water. That's the maximum that you can. So if you drink more than that, some of the water retain stay, and you're at risk for water intoxication. So, and I think 2 days later, when we talk about the water metabolism, I tell about what's going to happen, what's the symptom, and how does it work. So this is the one that I wanted to share with you guys at the first thing, that the basic definition of the oliguria, anuria, and then what is the urine and what we do. This is important things. Then we look at this and they give you a lot of information. And then um, tomorrow we mostly switch the gear about the acid base and mostly ABG in 1 hour. I'm hoping that we give you some. Yes. Yeah, those are the blood tests, right? You check the, oh, something. Yeah. So let me, we check the urine creatinine too. So the one that I mentioned to you for like a lady that's not drinking, um, she may give me the like in the urine, when they give me the 24 hours urine collection, I usually order, not me, everybody, order for the volume and protein and creatinine. So the volume, as I mentioned, the normal people pee 1 liter. She may give me 3 liter of urine, right? But she may say, okay, he doesn't know that I drink four. I did what 1 liter, I dump it, and I still gave 3 times normal. No way that he figure out. So and then they give me the one number, for example, 1.9 gram protein in 24 hours. And then I have another number for the um, creatinine, and it give me, for example, 600. So then I would say, okay, let me see. They said, okay, 3 liter is really good. It looks like just maybe he gave me 2 days, 3 days of the urine instead of one. Like in my culture, when you go to the doctor and they gave you something 24 hours, they said, okay, let's give 48 hours. Yet you give more sample, they have more material to examine. They give too much urine. They said uh, they don't want to, I mean, they want to have enough stuff. So for this one, I would say, okay, what's your weight? And they said, okay, her weight, imagine is 60 kilogram. So in the female, it's a 15 milligram per kg, and in the male is a 20 milligram per kg. Is a normal amount of that the creatinine production that they dump. So I do the calculation. I said it's a 60 times 15. I should have 900 creatinine in the urine. So, but the one that the lab gave me is at 600. So it means 1/3 of the time she forgot, didn't gave me this one. So whatever number that I have, like a 1.9, I add 30%. It said, oh, probably is gonna be 2.5 gram, not 1.9 that they gave me. So I corrected. So in the other way around, like if instead of 900 that I calculated, he gave me 1800. So then I said, okay, she gave me 2 days of urine collection. So then I deduct this one instead of 1.9. I would say, oh, probably you have 950 milligram is not a lot. So we basically check the amount of the urine, but the urine creatinine, that's one of the reason that we check is to make sure that the collection is appropriate, is enough or not. But we talk about the urine, I mean the BUN and creatinine. It's a blood test, is a marker that you assess the renal function. But urine creatinine is just for mostly to see the collection is right or not. Okay, so I give you guys some break. I know you guys go for the small group, right? And I join you guys again to talk about something. Any other question? Okay, so tomorrow, please come closer and pen. Yeah, thank you.